I'm incredibly grateful to be at Yosan. Yosan's given me a community. Yosan is giving me the tools to help myself in my everyday life. When people need help, I now have answers. I have tools to help you empower yourself and help you live life in a healthier and meaningful way.
We cannot stay the same. We must be better every single generation. That's how we can get better. That's how the society can get better. That's how civilization can improve. And that's our goal. How do we teach the next generation of practitioners that's going to be better than the previous generation?
The goal of Chinese medicine and what we strive to do in Yosan University is to empower people so that they and their healing capabilities can be awakened. Yosan founded the school in China at the turn of the last century. This was very unusual for a medical family to open its doors and say, if you want to be a doctor and if you want to help heal the world, come and we will teach you what we've known for all these years. And so he opened a school. So was our father, Omni, my brother, Dr. Dao, and myself, the three of us working together to fulfill Yosan's vision. When we opened Yosan University, we decided that not only are we going to name the school after him, we were going to continue his legacy, which were three parts. One was he did direct healing, which is what we're doing through the Dao Wellness. Number two, he was going to educate students to become doctors. So that's what we're doing through Yosan University. And three, we're going to be a resource in the community by providing low-cost or free services for those who can't afford it. And therefore, our community outreach programs. And this is our way of thanking him.
The first time I walked into Yosan, I felt that I had, that there was a place that would be able to teach me what I wanted to manifest in life. And what I want to manifest in life is giving not just healing through herbs, but through tender care and love.
The Yosan University Blunt Community Clinic is the most important part of the university. We must take care of our community. We must take care because we are part of the community. And as a Taoist principle, you must always give back to a community that you live in.
The Blunt Community Clinic offers the community low-cost acupuncture Chinese medicine treatment. It's on campus at the university, and it provides a resource, for the community to come in for not only treatments, but anything related to Chinese medicine and wellness. And for the students, it's important because being a low-cost community clinic, it draws in a large amount of patients, and that would give them a lot of patients to work with during their clinical training.
We have programs at Children's Hospital, Venice Family Clinic, Wise and Healthy Aging, the Wellness Center, and Being Alive HIV Clinic. These are just some of the many programs that we have in the community. And the goal of this is that, number one, we as an institution want to be a resource for the community. We are committed to helping people get well. We're also committed to helping our students become better doctors, become the best that they can be. And our students have opportunities to go out into these externship programs where they can fulfill their requirement, and working at the community level with Western medical professionals, specialists, psychologists, social workers, and others to really provide the service that is needed.
So we've been working with Yosan for over 9 years in this integrative medicine program. This is a great opportunity for them to see how powerful their medicine can be and to be able to establish relationships with very appreciative patients who otherwise have never had this kind of treatment and may never have this kind of treatment again. So it ends up being a very rich experience, not only medically and therapeutically, but also psychologically and socially, I think.
Being alive is a really great place to work because, for one, the community really needs it. You deal with desperately sick people. You see patterns that we don't really see in a regular clinical setting. But it's not only that the patients there are greatly helped, but the students have a great learning experience as well.
The majority of our patients, as I mentioned, do not have insurance and also are very low income, very low resources to be able to pay out of pocket for this kind of a really medically necessary procedure. Here it's offered for free, which is a tremendous opportunity for patients to be able to access something they would probably otherwise not be able to access, but that in fact is actually oftentimes more effective than prescription medications for the management of pain.
So what we want to do is to create these sets of treatments and help to a community that's affordable, that is safe, and then that's effective.
And I love the tradition that the school brings to their specialties. And so on my first day, it was years of anticipation built up, and I walked into our classroom and immediately all of the members of our class made this instant connection, and we just had this incredible community that has developed.
I think one of the most important part of the Yosan University education is helping students to discover who they are, to discover their energetics, and to discover their deficiencies and exits, just like a patient, just like sensing a patient. You need to know who you are first. You need to know your health status. And a lot of times, it starts with lifestyle.
We firmly believe in the actualization of the student becomes the medicine, meaning the doctor needs to develop him or herself. Students go through their program and they are required to learn and practice and master a Tai Chi form or a Qigong form or meditation so that they can develop themselves mentally, spiritually, and physically.
You know, Qi is an interesting notion. Basically, we could say that Qi is energy, and in a way, it's a bit like the wind because, you know, can we really see the wind? Not exactly, but we can see evidence of it. And so Qi is something that we have inside our body. It has all these characteristics, and there's ways to recognize it, but at the same time, we can't see it and bottle it, you know.
Qi and Qigong are meditative practice, and you can also learn a lot about yourself because your energy will show up in your movement. And if you can allow that to be your teacher, you can learn so much about life and so much about yourself.
It's not just getting an education, but their goal is to help you. They want to give you the tools to heal yourself as a person, because in order to heal other people, in order to help other people in their health, emotionally and physically, you have to be in a good place.
But what's interesting is as you graduate and you start practicing and you realize you want to be a better practitioner each day, it always comes back to the self. How centered are you? How calm are you? How much can you shut out the external noises and the social pressures and all that?
I would like all people, whosoever they are, they need to develop the healer conscience, healer awareness, because the soul, the mind, do have the power to heal itself. The external knowledge just as supplement for the soul, for the deep conscious, deep awareness to fulfill the duty in the life.
I remember very clearly the day when I walked into Yosan University for the first time. I was welcomed by this beautiful smiles of Marka, who was at the bookstore at that time, and Dr. Mao, who gave me a hug and said, "Welcome to the family." And I was so impressed because I didn't even know who he was at that time. But he gave me a big hug, and I immediately felt so welcome and so wonderful. And I just knew this is where I'm supposed to be.
Yosan University really expect the students to come with an open mind. And we are here to help them to really create a strong curriculum and path for themselves. Each student develop in a different speed, different ways. But the most important is to teach them how to critically analyze, critically think about medicine itself. Understand, for example, they must learn the fundamentals, which are your theories. They need to learn about herbs and also acupuncture treatments. They need to understand how the body works, the different points, different meridian that runs throughout the body. And obviously understand the etiology, the epidemiology, as well as the pathology of each disease are rudimentary to become a very good healer. But beyond that, really, at the end, all this knowledge that you learn, the most critical part is actually to become a lifetime learner. We teach our students to actually have the skill sets to learn on their own once they graduate. I think that's fundamentally the most important skill set you can ever have.
Our expectations for our students is that we would like them to obviously master the knowledge of the practice of Chinese medicine. They need to be well versed in being able to diagnose correctly patients when they come in with their problems. They need to be able to recognize not just in Chinese medical theories, but also Western clinical medicine. They need to recognize if there is a situation that calls for a second opinion.
I teach the basic principles courses, and my approach to it is, and I tell the students immediately that the objective of the course is to try to get them to think like Chinese doctors. And I tell them, this is a whole new way of thinking. Chinese thought isn't linear, and you can't really approach it the same way you've approached all your studies in the past.
Well, for one thing, we bring in the herbs. So there's a lot to look at, compare. They have to smell them, taste them. I make tea. So I know some herbal teachers just teach with words, but to me, that's just such a missed opportunity. So there's just a lot to look at. And I mean, what they say is, I'm so excited about herbs, so they're excited about herbs. I think that's, I'll never stop being excited about herbs because it's just my world. I mean, I just love it so much.
I have been teaching in Yosan for 20 years. But, I love to, teaching, and it's always you learn, through teaching, and you learn. I learn a lot. I learned a lot from my student. From some point, I'm their teacher, but from the other point, they are my teacher. They taught me a lot.
I always tell them it's important that you're now a community of healers, and it's important to help each other, support each other, and really be authentic out there, and learn to really put your energy and your heart now is no longer just in Yosan. Your heart is now with the world.
First time I walked in here, it was so peaceful and welcoming. I immediately felt like I was experiencing healing just being in the building. I couldn't stop smiling. I just knew it felt like home as soon as I came here.
The successes of our graduates are tremendously satisfying to us, because we are the 38th generation practitioner in our family, and so every one of our students represents the next generation healers. And so they're the 39th generation. So it really pleases us to see that they are successful and thriving.
So alumni to me, they are family members to me. And always keep in constant contact. I think that's critical for us to continue to learn together.
You know, the way that that Yosan has affected my life in practicing Chinese medicine, I would say one thing for sure, when I wake up in the morning, not most days, but every day, I feel great about what I do for a living. And so I'm excited about coming to work, you know, even 20 years later, you know. There's always something new to learn about it. And for me, it's, you know, I don't know, I don't tire from it. It's exciting to see that I'm actually having a direct impact in people's lives.
What I learned from the Yosan program is to be an effective practitioner, I needed to be technically well adept, which means when I do these things, it shouldn't hurt, the medicine should go down easily, and I should be nice, which is really what this is about. It's about having a patient-practitioner relationship that's based on trust. Some would say that that's not teachable, but I would disagree in that the program that they've set up at Yosan is very, very much teachable, which does not mean that you're going to change somebody's personality, but you're definitely going to make it the best it can be.
Yeah, I mean, it was really hard for sure, those 4 years. I mean, really, really hard. Almost as hard as giving birth, but it was worth it. It really was. It was a great experience.
I would like to, you know, if the universe allows it, start my own practice. That would be wonderful. I would really like to continue being part of a nonprofit, because doing the externship here at the Venice Family Pain Clinic, it allows me to reach a different kind of patient group that I'm not able to reach in a private practice.
We are in an era of integrative medicine. It's very important to learn from all aspects of the medicine the best for the world. Understanding genetics is equally as important to understand how acupuncture works. Understanding about pathology in a molecular level is equally as important as how the whole parts put together and work together. You need both. Today's physician cannot be a technician, cannot just be a scientist. There also has to be somebody who's a counselor, who understands human nature, who also understands how things work together as a whole. So integrative medicine is not about integrating different modality of treatments. It's about integrating your thought process. It's also about integrating how you do medicine. It's about seeing the whole picture.
The future model of healthcare is to be able to be in all medical setting where there is the Western medical care and there is the traditional Chinese medical care. And together we can serve patients of all backgrounds and all needs in a way that's most effective and also preventative and respects the patient as a person, because we are addressing their issues in terms of mind, body, and spirit.
If the urgent case, for example, car accident or soldier from the battlefield, need the Western care first. If a chronic disease, Chinese gentle medicine have a better advantage. So that's two medicine can cooperate together.
As we had more and more patients in common, we started to realize that there were so many facets to breast health that could benefit from all of the modalities he was providing, be it through herbs or acupuncture, teaching meditation, better nutrition, and a lot of patients who just basically, for example, maybe a little higher risk, I needed to whip them off their hormone replacement so they're miserable in menopause with their hot flashes and mood swings. And lo and behold, after just a couple of visits with him, they would feel fine. And all of that risk of taking hormones was eliminated, and all of their misery in menopause was abolished. And so we thought, wow, we really have something here. it can work on multiple levels. It's not just for the cancer patient.
There's been multiple studies published in Western literature looking at the benefits of herbal acupuncture medicine in proper prospective Western medical trials. And so the data's out there. They just have to at some point say, okay, it's real and I'll accept it.
I do refer extensively to Drs. Dao and Dr. Ni, who I've known for years, because since my first encounters with them, they, like myself, have always been open-minded to each other's portfolio of tools and had open respect for that. And that is the benchmark to me of a patient-centered clinician, where they're putting the patient first, not their own agenda.
I've treated people, for example, in cancer chemotherapy with Chinese herbs, and they have done so much better than most people do in chemotherapy.
That's where traditional Chinese medicine has a tremendous impact on many lives as they're introduced to this whole entire philosophy of wellness and balance that they had never achieved before. So they feel empowered by that. There is something I can do.
When there are couples that come in wanting to have a child, in some ways it's based on love. It's based on this beautiful love that you want to create something, the fruit of two people's love. And so trying to help someone to get pregnant, probably to me, is one of the most sacred work that I can ever do.
Over the last 35 years, we've just had a very common ground experience, and the patients have benefited from it. I had a woman I remember that had fibroids, just really active growing fibroids, uterine fibroids. And she'd had several operations, and I was seeing her and I'm thinking, we're gonna have to do another surgery. Young woman, and I was worried about uterine function after that. And I talked to Dao and I said, this lady is really a tough case, and I don't know whether you can do anything with these fibroids. They seem to be super sensitive to her hormone changes. And he said, well, let me work with her for a while. And I had done several ultrasounds and measured all of them, and there were 5 or 6 fibroids that were significant in size. I didn't see her for 3 months. She came back in and she said, Dr. Dao wanted me to come in and get another ultrasound. And I said, yeah, let's take a look, see how bad they are. And I looked, and I looked, and I looked. And I said, did you have surgery? She said, no, Dao has just been working on it. I said, I can't believe this, but you've got one tiny little fibroid here, but all the rest of them have disappeared. I said, they really have. And I said, I never believed that I'd see something like that. And if I hadn't done her ultrasounds before I sent her over there, I would have believed that, that was just all nonsense. But that was kind of a big awakening for me as to, this is really powerful stuff.
So I definitely see integrative medicine becoming more mainstream in a way, but maybe not even called integrative medicine, just called good medicine.
You matter here. You're automatically part of a community once you're here.
Everyone's got an interesting life story as to how they got here. So everyone's got something unique that they bring to the medicine. And it's exciting to be with a group of like-minded, intelligent, interesting people studying something so profound.
No one else is doing as comprehensive an integrative medicine program in a low-income community as we are. Yosan is a very valuable, fundamental, and early on part of that program. We couldn't be doing this program without Yosan.
They have an amazing center. I just can't say enough about it. I've seen a lot of the people that they've trained, and I totally accept them. I've never questioned their abilities. If they come from those guys, to me, they're good to go.
This teaching is not a tour of war. It's a tour of looking for life, looking for peace, looking for joy of life.
My vision for the future of Yosan University is that we're able to collaborate just like the way we practice with Western medical professionals, is that we can affiliate with educational institutions, hospitals, and research centers so that we can produce more availability, so that we can serve more people, and at the same time, this knowledge can filter into medical schools.
Yosan University is all about to give the world to become a safer place, to become a more integrated place, not just in the sense of medicine, but in the sense of good health, in the sense of good nurture of our environment at the same time. So by practicing integrated medicine, by using as much as possible natural ways on how we can heal our body, we hope to create a world with less chemicals. We hope to create a world with a better health status for all.